So a lot of my work is on ultra-wide field retinal imaging, and we've been developing this technology in telemedicine programs. So what this study looked at is whether we can automate the way we evaluate ultra-wide field imaging, specifically looking for hemorrhages and microaneurysms, and whether these hemorrhages and microaneurysms predict progression over 4 years. The data suggests that with a fully automated, computerized algorithm for detecting hemorrhages and microaneurysms, we're able to better predict the risk for progression over 4 years. This meant when you see hemorrhages in the retinal periphery, when these are present in a way that the HMAs or the hemorrhages and microaneurysms are predominantly outside the ETDR7 fields, the risk for progression may be as high as 4-fold increase. The presence of these predominantly peripheral lesions potentially may increase, or its absent may decrease the risk for progression. So this adds to our ability to better stratify, better prognosticate patients with diabetic retinopathy. So this is a fully automated way. So in eyes with diabetic retinopathy, the hemorrhages and microaneurysms can be as little as a single microaneurysms, but can be as numerous as 1,000. So counting these individually is completely not feasible. So an automated way is able to give us a precise number, and by localizing where these HMAs are, they're able to help us better predict which eyes are at risk for progression and which eyes aren't. So this can custom tailor your follow-ups for these patients. Patients can be followed for longer intervals or can potentially be followed up for shorter intervals. First, the ultra-wide field technology is very expensive. The automated algorithm is not commercially available. But what this data suggests is that this technology is available and in the future may potentially change the way we evaluate and assess eyes with diabetic retinopathy. With deep learning algorithms, what we can potentially do is to find lesions that we have not been looking at before. And if we find these lesions can help clinicians predict progression, and also, potentially a new lesion that we haven't seen before. Something in the retina that no one's been seeing or no one's been able to see. And now, with the learning algorithms, we can predict progression.